Ozempic, also known by its generic name semaglutide, is a medication that has gained significant attention for its effectiveness in managing type 2 diabetes and supporting weight loss. As a GLP-1 receptor agonist, Ozempic works by mimicking the action of a natural hormone in the body, helping to regulate blood sugar levels and appetite. With its growing popularity, many people are curious about what happens when you use Ozempic or similar GLP-1 medications over the long term. In this video, we'll explore the science behind these drugs, what research says about their extended use, and what patients and healthcare professionals should keep in mind. GLP-1s, or glucagon-like peptide-1 receptor agonists, are a class of medications that help lower blood sugar by enhancing the body's natural insulin response. They also slow down digestion and reduce appetite, which can lead to weight loss. Ozempic is one of the most well-known drugs in this category, but there are others, such as Wegovy and Trulicity. Understanding how GLP-1s work is essential for appreciating their long-term effects, as their mechanism of action influences both the benefits and potential risks associated with prolonged use. In the short term, Ozempic and other GLP-1s are highly effective at lowering blood sugar levels and promoting weight loss. Many patients experience improved glycemic control, reduced appetite, and a decrease in body weight within the first few months of treatment. These benefits can be life-changing, especially for those struggling to manage type 2 diabetes or obesity through lifestyle changes alone. However, it's important to remember that these positive effects are most pronounced when the medication is taken consistently and as prescribed by a healthcare provider. As more people use Ozempic and other GLP-1s for extended periods, researchers are gathering valuable data about their long-term effects. Clinical trials and real-world studies suggest that the benefits of improved blood sugar control and weight loss can be sustained for several years. However, the long-term safety profile is still being established, as these medications have only been widely available for a relatively short time. Ongoing research is crucial to understanding how these drugs affect the body over many years. One of the most notable long-term effects of Ozempic is sustained weight loss. Studies have shown that patients who continue using GLP-1s can maintain significant reductions in body weight over time. This sustained weight loss is linked to ongoing appetite suppression and changes in how the body processes food. For many, this means a lower risk of obesity-related complications, such as heart disease and certain types of cancer. However, maintaining these results often requires continued use of the medication. Long-term use of Ozempic is associated with ongoing improvements in blood sugar management. For people with type 2 diabetes, this means a lower risk of complications such as nerve damage, kidney disease, and vision problems. The ability of GLP-1s to help maintain stable blood sugar levels over years is a major advantage, especially for those who have struggled with other treatments. This effect can also reduce the need for additional diabetes medications. Research indicates that GLP-1s like Ozempic may offer cardiovascular benefits beyond blood sugar control. Some studies have found a reduced risk of heart attack, stroke, and other cardiovascular events in patients using these medications long-term. These effects are likely related to improvements in weight, blood pressure, and cholesterol levels. For people with type 2 diabetes, who are already at higher risk for heart disease, this is a significant advantage. While the benefits of Ozempic are clear, long-term use can also bring side effects. The most common are gastrointestinal issues, such as nausea, vomiting, and diarrhea. These symptoms often improve over time, but some people may continue to experience discomfort. Other potential side effects include gallbladder problems and, rarely, pancreatitis. It's important for patients to discuss any ongoing symptoms with their healthcare provider to ensure safe and effective treatment. Gastrointestinal symptoms are among the most frequently reported side effects of long-term GLP-1 use. Nausea is the most common, followed by vomiting and diarrhea. These symptoms are usually mild to moderate and tend to decrease as the body adjusts to the medication. However, for some individuals, these effects can persist and may require dose adjustments or even discontinuation of the drug. Monitoring and communication with a healthcare provider are key to managing these symptoms. Some studies have raised concerns about the risk of gallbladder disease and pancreatitis with long-term GLP-1 use. While these complications are rare, they can be serious. Symptoms such as severe abdominal pain, jaundice, or persistent nausea should be reported to a healthcare provider immediately. Ongoing research is needed to better understand the true risk, but for most people, the benefits of GLP-1s outweigh these potential dangers. Animal studies have suggested a possible link between GLP-1s and thyroid tumors, but this risk has not been confirmed in humans. The FDA requires a warning about this potential risk on the medication label, but current evidence does not show a significant increase in thyroid cancer among people taking Ozempic. Still, it's important for patients to be aware of any neck swelling or difficulty swallowing and to report these symptoms to their doctor. Long-term use of Ozempic does not appear to harm kidney function in most people. In fact, some studies suggest that improved blood sugar control may help protect the kidneys over time. However, people with pre-existing kidney disease should be monitored closely, as dehydration from gastrointestinal side effects could potentially worsen kidney problems. Regular checkups and lab tests are recommended for those at risk. There is limited evidence about the impact of GLP-1s on bone health. Some studies suggest a neutral or even positive effect, possibly due to weight loss and improved metabolic health. However, rapid weight loss can sometimes lead to decreased bone density, especially in older adults. Patients should discuss bone health with their healthcare provider, particularly if they have risk factors for osteoporosis. Some patients report changes in mood or mental health while using GLP-1s. While most people do not experience significant psychological effects, a small number may notice increased anxiety or depression. It's unclear whether these changes are directly related to the medication or to the experience of weight loss and lifestyle changes. Anyone experiencing mood changes should talk to their healthcare provider for support and guidance. GLP-1s like Ozempic rarely cause hypoglycemia or low blood sugar when used alone. However, the risk increases if they are combined with other diabetes medications, such as insulin or sulfonylureas. Patients should be aware of the symptoms of hypoglycemia, including shakiness, sweating, and confusion, and know how to respond if they occur. Regular monitoring and communication with a healthcare provider can help minimize this risk. Over time, some patients may notice that the effects of Ozempic become less pronounced. This phenomenon, known as tolerance, can happen with many medications. If weight loss or blood sugar control plateaus, healthcare providers may adjust the dose or recommend additional therapies. It's important to have regular follow-ups to ensure the medication continues to meet your health goals. If Ozempic or another GLP-1 is discontinued, many patients experience a return of appetite and gradual weight regain. Blood sugar levels may also rise, especially if no alternative treatment is started. This highlights the importance of ongoing management and the need for a long-term plan with your healthcare provider. Lifestyle changes, such as diet and exercise, remain crucial even when using medication. While Ozempic and other GLP-1s can be powerful tools for managing diabetes and obesity, they work best when combined with healthy lifestyle habits. Regular physical activity, balanced nutrition, and stress management all contribute to long-term success. Medications can help, but they are not a substitute for a healthy lifestyle. Patients should work with their healthcare team to develop a comprehensive plan that supports both medication use and lifestyle changes. GLP-1s are typically prescribed for people with type 2 diabetes who have not achieved their goals with other medications, or for those with obesity who need additional support for weight loss. Not everyone is a candidate for these drugs, and a thorough medical evaluation is necessary before starting treatment. Factors such as medical history, current medications, and personal health goals all play a role in determining if GLP-1s are appropriate. Certain individuals should avoid GLP-1s, including those with a history of medullary thyroid cancer, multiple endocrine neoplasia syndrome type 2, or severe gastrointestinal disease. Pregnant or breastfeeding women should also consult their doctor before using these medications. It's essential to review your full medical history with your healthcare provider to ensure safe use of Ozempic or similar drugs. GLP-1s can interact with other medications, especially those that affect blood sugar or slow down digestion. It's important to inform your healthcare provider about all the medicines and supplements you are taking. This helps prevent potential interactions and ensures that your treatment plan is safe and effective. Regular medication reviews are a good practice for anyone on long-term therapy. Regular monitoring is essential for anyone taking Ozempic or other GLP-1s long-term. This includes routine blood tests to check blood sugar, kidney function, and other health markers. Follow-up appointments allow your healthcare provider to assess how well the medication is working and to address any side effects or concerns. Staying engaged with your healthcare team helps ensure the best possible outcomes. The cost of Ozempic and other GLP-1s can be a barrier for some patients, especially those without insurance coverage. These medications are often expensive, and not all insurance plans cover them for weight loss. Patients should discuss options with their healthcare provider, including patient assistance programs or alternative therapies if cost is a concern. Accessibility is an important factor in long-term treatment success. Insurance coverage for GLP-1s varies widely depending on the indication and the specific plan. While most plans cover these medications for diabetes management, fewer cover them for weight loss alone. Patients should check with their insurance provider to understand their benefits and any prior authorization requirements. Navigating insurance can be complex, but it's an important step in accessing long-term therapy. Many patients report positive experiences with Ozempic, including improved blood sugar control, weight loss, and better overall health. However, experiences can vary, and some people may struggle with side effects or find the medication less effective over time. Sharing experiences with healthcare providers can help tailor treatment plans and address any challenges that arise during long-term use. Healthcare providers play a crucial role in guiding patients through long-term GLP-1 therapy. They help monitor progress, manage side effects, and adjust treatment as needed. Open communication and regular check-ins are essential for addressing concerns and ensuring that the medication continues to meet the patient's needs. Building a strong partnership with your healthcare team supports better long-term outcomes. Ongoing research is expanding our understanding of the long-term effects of GLP-1s like Ozempic. New studies are exploring their impact on heart health, kidney function, and even neurological conditions. As more data becomes available, recommendations for long-term use may evolve. Staying informed about the latest research helps patients and providers make the best decisions for ongoing care. Beyond diabetes and weight loss, researchers are investigating other potential uses for GLP-1s. Early studies suggest possible benefits for conditions like fatty liver disease, cardiovascular disease, and even neurodegenerative disorders. While these uses are not yet approved, they highlight the growing interest in the broader therapeutic potential of GLP-1 medications. Education is key to successful long-term use of Ozempic and other GLP-1s. Patients should understand how the medication works, what side effects to watch for, and the importance of regular follow-up. Healthcare providers can offer resources and support to help patients make informed decisions and manage their health effectively over time. Sticking to a long-term medication regimen can be challenging. Factors such as cost, side effects, and lifestyle changes may affect adherence. Patients should discuss any barriers with their healthcare provider, who can help find solutions or alternative therapies if needed. Consistent use is important for achieving the best results with GLP-1s. It's important for patients to have realistic expectations about what Ozempic and other GLP-1s can achieve. While many experience significant benefits, results can vary. Weight loss may plateau, and side effects may persist for some. Open dialogue with your healthcare provider helps set achievable goals and ensures that treatment aligns with your personal health priorities. Support from family, friends, and healthcare teams can make a big difference in long-term medication success. Encouragement, accountability, and shared experiences help patients stay motivated and overcome challenges. Building a strong support network is an important part of any long-term health journey, especially when using medications like Ozempic. Long-term use of GLP-1s often requires ongoing lifestyle adjustments. This might include changes in diet, increased physical activity, or new routines to manage side effects. Flexibility and a willingness to adapt are key to maintaining progress and maximizing the benefits of medication. Healthcare providers can offer guidance and resources to support these changes. Regular health monitoring helps detect any complications early. This includes checking for signs of pancreatitis, gallbladder disease, or thyroid issues. Early detection allows for prompt intervention and reduces the risk of serious health problems. Patients should be proactive in reporting new or unusual symptoms to their healthcare provider. As more people use GLP-1s over many years, the body of safety data continues to grow. So far, the evidence suggests that these medications are generally safe when used as directed. However, rare side effects and long-term risks are still being studied. Patients and providers should stay informed about new findings and adjust treatment plans as needed. Every patient is unique, and long-term treatment with Ozempic should be tailored to individual needs and goals. Factors such as age, medical history, and lifestyle all influence the best approach. Working closely with your healthcare provider ensures that your treatment plan is personalized and effective for your specific situation. Empowering patients with knowledge and resources helps them take an active role in their health journey. Understanding the long-term effects of Ozempic, knowing what to expect, and being proactive about side effects all contribute to better outcomes. Patients should feel confident in asking questions and advocating for their health needs. Technology can support long-term medication management in many ways. Apps and devices can help track blood sugar, medication schedules, and side effects. Telemedicine allows for easier communication with healthcare providers. Embracing technology can make it easier to stay on track and manage your health effectively over time. Many communities offer resources to support people using GLP-1s, such as support groups, educational workshops, and online forums. Connecting with others who share similar experiences can provide encouragement and practical tips for managing long-term therapy. Patients should explore available resources to enhance their support network. Some people may face stigma related to medication use for weight loss or diabetes. It's important to recognize that managing chronic conditions is a personal journey, and seeking help is a sign of strength. Education and open conversations can help reduce stigma and promote understanding within families and communities. The field of GLP-1 therapy is rapidly evolving, with new medications and delivery methods in development. Future innovations may offer improved efficacy, fewer side effects, or more convenient dosing. Staying informed about advances in treatment can help patients and providers make the best choices for long-term care. GLP-1 medications like Ozempic are making a significant impact worldwide, helping millions manage diabetes and obesity. As access improves and research continues, these drugs may play an even larger role in public health. Understanding their long-term effects is essential for maximizing their benefits on a global scale. To summarize, Ozempic and other GLP-1s offer significant long-term benefits for blood sugar control, weight loss, and possibly heart health. However, they also come with potential side effects and require ongoing monitoring. Working closely with healthcare providers, staying informed, and maintaining healthy lifestyle habits are all essential for long-term success with these medications. The long-term effects of Ozempic and other GLP-1s are still being studied, but current evidence supports their use for many people with diabetes or obesity. As with any medication, it's important to weigh the benefits and risks, stay engaged with your healthcare team, and make informed decisions about your health. With the right approach, these medications can be a valuable part of a long-term health strategy. As research continues and new therapies emerge, the future of GLP-1 medications looks promising. Patients and providers should stay informed about new developments and be open to adjusting treatment plans as needed. By working together and embracing innovation, we can continue to improve outcomes for people using Ozempic and similar medications for years to come.